The bones in the ankle and foot include the 7 tarsals, which are classified as short bones, the 5 metatarsals, classified as long bones, and the 14 phalanges, which are also classified as long bones. This image shows a picture of the right foot from a dorsal aspect. And this is where we can clearly see the 7 tarsal bones and their arrangement. If we start superiorly, we see the talus sitting on top of the calcaneus, which forms the heel of the foot. If we progress distally along the medial side, we first see the navicular and then come to the 3 cuneiforms, which are designated medial, intermediate or middle, and lateral cuneiform. Finally, we finish with the cuboid most laterally. It can be helpful to use mnemonics to remember the arrangement of the tarsal bones, and this mnemonic, the circus needs more interesting little clowns, has the same order of tarsal bones as we just described them. As we move into the foot, we find the 5 metatarsal bones, and then in the toes we have 3 phalanges, proximal, middle and distal, with the exception of the big toe, which just has a proximal phalanx and a distal phalanx. There are many articulations found in the ankle and foot. The first is between the talus and the tibia and fibula. Together they form the talocrural or ankle joint, which is classified as a modified synovial hinge joint. There are a number of different joints between the tarsal bones. We won't name them specifically, but generally they're classified as synovial plane joints. Between the final row of tarsal bones and the metatarsals are the tarso-metatarsal joints. These are all classified as synovial condyloid joints and perform flexion, extension and abduction, adduction, with the exception of the first tarso-metatarsal joint, which is classified as a synovial saddle joint, analogous to the first carpo-metacarpal joint of the thumb. At the ball of the foot, we find the metatarsophalangeal joints, which are also classified as synovial condyloid joints. And then finally, between the phalanges, we have the proximal and distal interphalangeal joints, which are both classified as synovial hinge joints.